a graduate student, when you were in internship, when you were on postdoc, and even now, you have really thought a lot about how to balance your work and your family, which I know is important to you. So, and I know it hasn't been easy. So I just want to give you the chance right up front to sort of share with our audience about that journey and perhaps how your sort of openness to experiences and the way you did carry all of that along with you kind of has contributed really to your success in your career.
Sure, thank you. Yeah, so I started the Psy.D program and my MPH with this very clear vision of what I was going to do. You know, I was going to work at some nonprofit or maybe the VA and be full-time and design programs and travel internationally and all that cool stuff. And I had a vision, and it was changing all the time. You know, I got into adolescent health, it was going to be an adolescent clinic. I got into veteran health, it would be veteran clinics. Sometimes there's a period where I was going to live in Utah or I forget where, New Mexico, and think about working for IHS, which I'm still very passionate about. So I had a lot of ideas of how I was going to do this work, and I was really excited about it. Third year of graduate school, I had a baby, and I had not envisioned what motherhood was going to look like that much, it turns out. And it not only was part of my life, it was a main part of my life. And I started as a little bit of a shock. So when I adjusted to the idea of balancing parenthood and school, I started to think about how I was going to construct my life post-baby. And I think a lot of things happened at once. I think I was surprised how little societal support there was for really pursuing kind of these dreams that I'd had while simultaneously raising a young child with grad school and occupational demands, that kind of thing. Luckily at PAU, there are many, many people who were supportive, but it was very much, I started to experience that FOMO, or that kind of fear that I was going to have to abandon the plans that I'd made and the dreams that I'd had for my work because I had decided to have a baby at this point. And so integrating these two identities was rocky at the beginning. And I was quite sure I wasn't ever going to be able to do the things I wanted to do, which were work in public health, do some tech development, and see clients clinically, and then also teach. This is part of the problem, right? Yeah, I had like 12 things I wanted to do, but I was quite sure I wasn't.
They're all good. They're all good.
Yeah. So I felt a little bit doomed career-wise, and I kind of wasn't sure where to go from there. And I have since learned that this is a feeling that many parents feel whenever they decide to have children, but often when they're doing it in graduate school or during their training. And I think an essential part of it was really taking a moment to seek support, to find the mentorship and to find it very specifically, and to think very critically about where I might be able to, who I might be able to model my path after. But kind of something you kind of referenced, Maureen, I had to be exceptionally flexible about what the future looked like. I, no longer was going to be able to, had all these hopes of getting a grant and then going into an academic, and for various reasons related to kind of my home life, I wasn't going to be able to do it as linearly as I had set out. And so instead of kind of making a plan and pushing through it for 5 years, I really had to start looking for what opportunities materialized, which was a different approach for me, for sure.
Yeah, I think that flexibility is really important. I mean, first of all, my whole career has been geared to trying to fix the world in such a way that you don't have to feel the way you felt. So, I think we have a lot of work still to do. There's no reason we can't have our families and our work. We just have to keep at it, right? We have to keep trying to make the world understand that this kind of is the way life is, and we better be able to make it work. But I do think for now, and for particularly when you were going through your training, that flexibility is so critical. But you stayed open, I think, to ideas, and I think that's to be commended. But I think it's also led you in this incredible path that you've been on.
Well, I had incredible models and mentors. Like Barr was an incredible anchor who, through the whole thing, was just steadfast in his support of all my dreams. And Julia Hoffman helped me find a position that was not full time, but that I could use postdoc hours. So really holding to, really seeking out that mentorship and kind of being active with it was really key.
Well, and I love that you didn't give up on the public mental health, right? I mean, we're seeing now in this time of pandemic and, crises after crises, that it's really the public mental health system that is going to get us through this. And we need people like you and others to be in that system so that we can get the mental health care to the people who need it, right? Because that's, we know some people have access and many don't, and that's what you've been working on. So along that line, let's hear a little bit about the work you do for the VA in the mobile apps team, because that's obviously directly related to getting care to people.
Yes, absolutely. So I've been incredibly lucky to work with mobile apps team. I worked there as a grad student in 2012 under Joe Ruzick, who's here tonight, and then returned in 2016 and have stayed there since halftime. And the mobile apps team designs the free mental health mobile apps available to everybody to download. You can do that now, that come out of the VA and the Department of Defense. Probably the most well-known and the oldest one is PTSD Coach. And it's been an amazing experience for a lot of different reasons. First of all, it's honed a skill set that I didn't know I had, and I've been able to acquire some skills I think that we don't naturally associate with psych or clinical psych. What we do there is we kind of come up with the ideas for apps, or somebody in the VA system has an idea for an app. We engage what we call subject matter experts, and so content experts from within VA or outside of VA. And then we start to construct an evidence-based or evidence-informed app that's interactive, has psychoeducation, interactive tools, and assessment, and is going to be available on Android and iOS to everybody in the US and beyond. And now they've been adapted by other countries. But we take it through the entire process. So everything from mental health content writing to the user interface, UX, thinking about how it looks on the screen and how people might use it, to the back end. I don't do development, but we work with this amazing team in Italy that does development. And the testing, which many of PAU students have been engaged in the testing. And then also my very favorite part, the dissemination, right? How do we get these apps out to the public? Mm-hmm. And you'd be amazed how hard it is to sell free things to the public. It's pretty difficult. I've tried a lot of things, which people here know, but it also can be incredibly impactful. If you're on your computer and you go to the reviews for COVID Coach on the Apple Store and look at the most recent ones, you'll see, I think a recent one, I read these when I'm depressed, but a recent one is that, this is the best app I've ever seen. And I kept looking for the ads, and I kept looking for where I had to pay to get more information, and it wasn't there. And so people are literally shocked to have a free resource that they can access at any time that's government developed. And COVID Coach was led by Dr. Beth Jaworski, who is a social psychologist on the team, who also has young kids, and worked incredibly hard to integrate kind of elements of public health, kind of social psych, clinical psych into this package that from beginning to end took, I think, 12 weeks to complete. So it's been such exciting work. Jason Owen is the team lead, and I kind of help out on all stages of the process. But I think more importantly, it's helped me develop the skill set that is completely different than what I thought I would ever have, but really motivating. And the public health mission of the VA apps is so unique because there is no profit involved. It's simply to better the mental health and the health of the nation. And I just find that mission-driven part of it really exciting.
Yeah, I'm looking at Ricardo smiling down there, knowing that is his mission, and certainly so many people on this screen and at PAU have that. I mean, it's so exciting. I think I love that you talked about that comment, because I think so often in our healthcare system, we're waiting for the bill will be there'll be something will happen where I end up having to pay unexpected costs, right? So people are are really, it's just a wonderful thing what you do. And I know we weren't really going to talk too much about it, but you and I also talked a little bit about how we had Sam Jaffe as one of our superstar psychologists, who's a UserX experimental psychologist at Google. And we were talking about the need for more training on that side of the house. So can you say just a little bit more about that? I know that's not your thing exactly, but yeah.
Yeah, no, it's very, so we have been, I'm always looking for people who can help us out on the team, either graduate students or people who I could subcontract to. And it's so hard to find people because there's now more interest. It used to be there was no interest. People would be like, I'm not even sure what you're doing. I don't do development. But now there's more digital mental health interest. But the blend of the kind of psych background and the UX UI is unique, and many people can do it, and it actually requires minimal training. And there's also some design thinking in there, which I'm terrible at, but it's so integral to these apps. If you go on the App Store and look at all the mental health apps, you'll see the ones that you know the best, Headspace, Calm, but then all the way down, you'll see ones that clearly are not written by people with mental health expertise, but are beautifully designed. Or you'll see ones that are written by people who know a lot about mental health, but are basically, a long scrolling screen. And that's where we were for a long time. And I think what the mobile apps team has done, what Julia and Jason and others have done, is assemble a team where you have that design and UI and mental health kind of group all together. It's really interdisciplinary. And being someone in psych who can use the language and kind of do the design piece, it's just an integral skill set that there's not enough people to hire, even here in the Valley. So I want to encourage everyone to do it.
Well, I think, I know something Julia talked about for sure, and Sam talked about this, and now you've talked about it, the importance of being able to talk the language a little bit.
Right.
Right. That you being familiar enough to be in a room where you can bring your expertise and people will hear you.
Yeah, and to be clear, I know nothing about the language. I talk all the time. It's a big problem. So when I'm quiet, I'm just trying to listen, kind of to hear what other language people are using. But even though I know nothing about it and I have I don't code anything, in the last 4 years, I've been able to figure this out a little bit and kind of be up with the lingo enough to really actually have these conversations with people in the private sector that helps both of us. They learn from us, we learn from them. And so it's been great. And it's been so exciting to be in a field that I never thought I would be in or could be in. And all of you can too. So it's myself.
Well, one of the things we try to do at PAU, I think hopefully we did with you, and hopefully we still do, is instill a strong commitment in the importance of research, obviously, and sort of evidence-based practice.
Yeah.
And what you just talked about is, and something we're working on at PAU that's newer, is evidence-based teaching. Now, and what you're talking about is sort of evidence-based design in a way, right? So psychologists do the kind of research that gives us the knowledge that we need to do a lot of different things, but I'm wondering, we get that as people in the field, but how have you been successful at convincing others, probably not at the VA, you don't have to work too hard, but in other settings, the importance of science-driven approaches? Like, why is it, why do you have to bother with all this research and worrying about that, as particularly in the private sector?
Yeah. Well, I've been lucky, to work with people like Megan Jones, who have this amazing kind of background and just focus on ways to kind of generate evidence and to use research. And at Headspace, she's done such an amazing job. And I know she spoke before, but I think for me, it's been really interesting in the private sector. You're right at the VA that it's all very evidence. Sometimes they're like, you can't do that, Katie, you just made that up. True. But in the private sector, I think there's two forces at work. One of them is that if they talk about being evidence-based and science-driven, then that's, it's good for marketing, right? Because they're often trying to sell to a population that grounds itself in that. Everyone has their Fitbit and, so that's been good. I'm always curious when I see a company pop up, I always go right to their research background and I want to see how into it are they. But the problem is that I think often we see these companies pivot for the profit. And so they're moving away from what might be grounded in evidence or scientifically driven. And I think we see that a lot. And it gets a little dicey, right? When we're starting to say, well, this is the type of therapy we would do, and then we put that in an app, and then we change the wording of it and the pace of it and the cadence of it and the person who's delivering it, and right, and then we charge you up for it, and then it kind of moves away from the science and the evidence that we're used to relying on. I think for me, what's been really successful, and part of the reason is the Psy.D program specifically has made me be able to be fluent in the science, but also allowed me to be a consumer of research. And so when I interact with a private company, or if I'm consulting or I'm talking to them through the VA role, I'm able to say, well, did you see the latest paper about this? And it gives me a sense of how grounded in the evidence they really are. Mm-hmm. And it also gives them a sense that we're coming at this from a real scientific mind. So I think being a consumer, being taught to really consume the research and to check back and to stay up on it, is more of a skill that's allowed me to assess which kind of companies, which kind of tech companies, I want to be involved in, and who's doing the work that we really think is useful in that regard.
That makes a lot of sense.
Yeah, there'll be millions of them. It's so fun to look at the products coming out and kind of think, well, why would they think that would work, right? but it's really interesting.
Well, and you said that you're quite a CBTer, yourself. So you've certainly been schooled in that way.
Yeah.
So talk a little bit more about your other work that you do, just so people can see the range of things that you're working on.
Sure, and actually it's a good segue, because I work as a perinatal psychologist for a private practice called Practice San Francisco, and I got into that work. This is one of those examples of where I came out of a VA, 2 VA practica, a VA internship, and a VA themed postdoc, and a psych assistantship with a VA person, and said, I want to work with pregnant women, but I was at Kaiser on the crisis team, and I had my own postpartum experiences that made it clear that the postpartum perinatal population is not getting support. Access is very low, stigma is very high. And so I started being interested in running low-cost groups for postpartum women in San Francisco, where I had my babies. And I joined this practice with Dr. Nia Kaiser, who's a child psychologist. And it's amazing. And it's been fascinating to think about how can we do this work through a public health lens. And so I do groups and individual treatment at the private practice. And it's very, I think the most fascinating part to me is how a very highly resourced population can basically have nowhere to go for care. There are many private providers who pay out of pocket in San Francisco, but at this moment, I cannot find a perinatal provider with space anywhere in the Bay. And if you're wanting to use insurance, like I did for my therapy, it's impossible. So it's been another area of public health. And I've had the opportunity to talk to Dr. Barrera here at PAU about it and think really about doing exciting things, but it's just another area where a public health lens is so critical. But yeah, so I'll leave it there.
So important. And I think there's so much potential there for us to, as I mentioned, you were heading into a strategic planning process. So I think we need to listen to some of the things you're saying and try to fill some of that need. I think that's really, it's really important. So I want to leave time for people to ask you things, but I just want to ask a couple more things about kind of the tech mental health space, since that's obviously why we're here.
Yeah.
How have you seen the role of psychology and particular psychologists sort of evolve as the high tech sector has evolved, especially, I guess, sort of Silicon Valley focus? Like, what have you seen over time?
Yeah.
Observed.
Well, I don't know if anyone's ever seen the Metallica documentary, Some Kind of Monster. Probably a small population, but there's a therapist. I used to watch that, and they bring in a therapist.
Oh, yes, but
No, but watch it tonight. But they bring in a therapist to talk to the band, and I remember watching that and being like, I want to be that therapist who talks to the band. And then as I got through grad school, I realized, no, that's an IO therapist. I don't know how to do that. But I think, coming back to the question, as the digital mental health scene grows, basically the need for people with a psych background is everywhere. It's not only in product design, which is just different from product content writing, right? So there's the design lens, there's the actual writing of the content, but it's also in how these companies function, like relationships between founders and there's tons of clinical providers in the city who focus on relationships between founders. I've seen couples counseling requests for relationships between founders, but also, working with founders. And outside from the clinical lens, thinking about organizations and how to grow them, right? That kind of thing. And I didn't think I had the skill set for that. And I don't do that work specifically, but coming out and learning it from psychologists in the area who are doing that consulting work, I think as the growth of digital mental health takes off, we're realizing that there's a role for psychologists in almost every department. I think the previous speaker, did you say, was working in the people, right? HR,
yeah,
right? So yeah, as this industry grows, it's not only an opportunity for design thinking, for content development, but also for thinking about all the working parts of these companies and thinking of using the psych lens there as well.
Yeah, I think I was talking to one of our alums the other day who is the first PhD psychologist at one of the biggest public health. It's just crazy. So even in the public health center, we don't totally understand the value of having PhD level psychologists. But I think in the private sector, it's even more important that we make the point of how useful we can be in so many ways, and as you just described. So it's really exciting, I think, for, we have a new saying at PAU, or a sort of new branding at PAU, which is we're at the forefront of psychology and counseling. And I think truly this is one of the features of that, right? It's just that psychology can play such an important role in so many different areas. And one other area I want to ask you about is, because it's really important to us and to our students, and that's the really mental health disparity, mental health equity, which I know is so important to you. And you've been kind of focused on it, really, I think, in a certain way. And I think you also said to me that you had done some work on, which we're seeing now in the COVID vaccine development, in getting underrepresented groups into research as well, right? So that the research itself has meaning for when it gets applied to the population. So do you have any insights or advice about how we can best train students to think about this, how to infuse that into the work that we're doing to get students ready for this world?
Yeah, I don't know if I'm qualified, but I think that, the first thing we can all do is train therapists of color. We need therapists who represent the population that we're serving. If we're going to do public health, we need to represent the public. And so certainly in my clinical work in perinatal health, this is an important focus, and one that we can really all reflect across training programs. And so that's exciting. I think the second thing, and something I really think about a lot and try to emphasize, is I think a lot of us focus on the intervention in the room or the product in the room, but can we shift our focus to how people are getting to the room or to the Zoom room or to the app, right? What are the different forces at work before they get to our product? Can we apply our public health, mental health mind there? What about the stigma against uh, going to therapy? What about the fact that I don't have a working device, or I don't have internet access? How can we talk about kind of cultural ideas and how they affect our ability to access care? How can we talk about structural racism and how it affects our ability to access care? And I think sometimes as clinical psychologists, there's the idea that other people are doing that. But I don't know that. I think it's our role too to shift our view from this cool intervention we want to create to instead all the intervention, we know that most of the interventions work about the same. So how do we get more people in? How do we really think about the process rather than the outcome in that way? And so I think some training around that, almost emphasizing that kind of stuff is very exciting too.
Yeah, I think that's great advice. So there's a question in the chat about that actually leads into the next question I wanted to ask you anyway, which is that you did work for a for-profit internet company at one point. So what advice do you have for our students and for our audience as to how best explore their tech-based interests? Like any advice who might want to go for a student who wants to go in that direction, right? Or as opposed to VA direction, how could we think about that?
I wrote this down because I wanted to make sure. So I think the main advice I have for students is that you're always networking, always. Like you think, you're at a practicum interview and you're never going to see this person again because maybe you're not that interested in the site. You'll see them again. And you might be hiring them or they might be hiring you, but you're always networking. So always be networking. I started trying to get different practicum placements years before I applied for them because I really wanted them. And I was that creepy person who would be like, oh, hi, doctor, and they didn't really know me, but I would say, I heard you do this kind of work. And I think in the private sector, network even more, right? Like I'm doing this talk right now. If there's something I said that's interesting, email me tomorrow and say, hey, do you know what's her name? I heard about this company. Do you know them? Because if I get that email, I probably don't know them, but I might know somebody who knows them and I'm happy to connect you there. Kind of be really bold about that. And if it's hard for you, practice sending emails to people you don't know, because this is a small industry. It's a small area and it's a relatively small industry. So everyone you speak to is probably connected to someone you'd like to speak to in the future. I had a list, sorry.
Oh, I love that. I love that.
The second one was be very bold with dreams and tell everyone about them until they tell you to stop talking. Like I told everyone, I said like 15 years ago, I'm going to work at the San Francisco VA and I'm going to do some tech stuff on the side or something. And people are like, well, you can't do that. You can't be a VA person and a tech person. I said, you can't combine those two things. But I kind of told everybody and everyone's like, I know you're going to do that. And I don't work at the San Francisco VA, but I work at the Palo Alto VA, which is awesome. And the reason it was important to tell people is I had colleagues and friends who came to me and said, hey, didn't you want to work there? I just saw this job posting, right? They started sending me that stuff. And so I would email people I didn't know and say, hey, your job looks awesome. Can we get a coffee or can you tell me how you got there? And so that kind of thing. And then the third thing that I think is most important, don't job search, job create. None of the jobs I have existed before I had them. I talk a lot, right? And people are probably sick of me. They're like, sure, you can come work for me. But I really wanted to work on, I really wanted to do postpartum groups in the city, but I didn't want to run them myself. And so I found this person who was willing to have it happen out of her clinic. And she had that idea too, but it wasn't happening yet. I really wanted to do app stuff as a grad student. And I contacted Julia Hoffman on Facebook in a message and said, hey, I see you're doing app stuff. Could you want someone to work for you? And so I think of the job first. Like I just wrote someone an email today and said, hi, I know this position doesn't exist yet, but I think it's going to come up in the next 5 years. So when it does, will you let me know so I can apply? And she probably thinks I'm nuts, but she probably also will let me know.
Mhm.
So really think about the job you want and then try to convince people to create it.
Yeah, no, I think that is really, really good advice, and it spans all domains. I think it's some, and it's hard. I think it's hard for students to, it's hard for anyone to sort of realize they really need to be that way. But I think that's important. So we have a question on the chat. I wanted to get
Sure.
another one in, and I've got a couple more, but I wanted to get another one in. Someone who also heard Dr. Munoz speak earlier today, so that's exciting. And is wondering, so it's somebody who's a product designer at a private mental health startup, and wondered if you have advice on ways to reach reach people who need the care. Like you talked a little bit about it, but what are some strategies we might use to, is there anything that you've tried that's worked well to kind of get people to sign up, to kind of use the,
How we get to the target populations?
yeah,
Yeah,
exactly.
I'm glad you asked, because I have this project at the VA that's totally nuts, where I started calling all the providers in Alaska from a list of licensed providers in Alaska, and I just Googled them all and started calling them on the phone. So do I have any really great ideas? No, but I think you can do something like that. And eventually I hit on a professor in Alaska who, poor guy, answered his phone. And I said, hi, I'm calling to tell you about the apps. And he knew somebody on the team, of course, at the VA. And so then we were able to have a joint email where we make that connection. So I think identifying what group, where you want the care to be, doing a needs assessment, and really reaching out to those community leaders is really important. One thing my public health masters I learned a ton from was the idea of when we're going into communities to provide care, we need to work with community leaders, not just do cookie cutter interventions where we say, hey, this worked for somebody at 401 Corey, this should work for you. But so really, again, networking with leaders of that community, looking for connections and setting up from there.
That's great. And that actually, I hope that answered another question we had from a doctoral student from Long Island University, my old stomping grounds in New York. So Deepak, I hope that answered your question as well. But I think you relying on community leaders is good practice in so many ways. And I think both as researchers and practitioners, we need to be doing a lot more of that, right? So I think that's really important. Let's see. Let's see. Where would you, oh, here's a good question for you. Where would you like to be in 5 to 10 years? So
Good.
do you still have dreams?
The short answer is Hawaii. But oh yeah,
Hawaii without quarantine, right?
Right, Hawaii without quarantine. I think about this a lot, and I think in well, I know exactly where I want to be. I want to be in the Presidio, which I love the ambiance of running a small nonprofit that trains clinicians in how to reach difficult populations, or populations that traditionally don't have access to care. And the reason I chose this big umbrella is because when I was a Psy.D student, I was constantly stuck with this: should I be a teen therapist because I love working with adolescents, or should I be a veteran therapist because I love the VA, or should I be a perinatal therapist, or should I do crisis work because I love crisis work? And I'm not good at I'm very stubborn. And so I decided that I wanted to do this nonprofit where we have trainees, and we're thinking about how to pull people into care from all those different populations who might not normally have access. And Bar and I got to do a little bit of that when we set up an intervention at the YMCA sites in San Francisco. That was short-lived, but really cool, because I found myself at the Bayview Y working with a group of teenagers who, we were talking, it was more of a support-based group, but we were talking about the very real struggles that they were experiencing outside of a normal care setting. And it was really impactful per their report, but mostly really impactful for me. And so bringing the care to people is something I'm very passionate about. So yeah, some kind of nonprofit in Hawaii that does that.
I love it. Well, let me know if you need someone to be on your board.
I will. Don't worry.
I'm signing up. I'm signing up.
Everybody, often. Yeah.
But I think that point about bringing the care, I mean, really one of the things that technology has allowed us to do, and I love Bar's map showing, where we have access to services and where we don't, right? And Ricardo's work trying to get these resources to people who, ideally everyone would have a psychologist sitting next to them at all times, and they'd walk around with a lot of care, but that isn't the world we're in. So I think that technology can get that. It makes it possible, right? That some of those folks can actually be reached, but think of what has to be done to make that infrastructure work and make people trust that is for them, right? I think that's another piece of it, is the trust piece for this work. So, I mean, there's so much there. And I'm thinking about one of our students who just finished her MPH. She took a year between her finishing her coursework and her internship to do her MPH at Johns Hopkins. And I'm just thinking about the importance of that public health perspective, and that we need to really think about how to bring that to our students and make sure we're getting that.
Hey, Maureen, this is Joe. Is it okay to quickly make a point?
Absolutely, please.
So, without wanting to blow the horn too much of PAU, maybe it's clear to everyone on the call, but there's a sense in which I think PAU now is probably the best place in the United States for a psychology graduate student to set themselves up for, as Katie has done, for really an exciting career, because you've got arguably the strongest faculty in this, probably of any of, except there are comparable one or two other institutions. You've got Bar Taylor, Ricardo Munoz, you've got Eduardo Bunge, you've got Jan Laken and others who not only are international names, but also between them, they know everybody in the world in the field, including in Silicon Valley. So they are also a way of assisting with all the networking that Katie, I think, you really said how powerful, important. So you come out, you're well-trained in clinical psychology, you have had real-time, real experience in a lab doing things, technology, which gives you a skill set and a visible experience above anyone else. And in your case, I think this is smart, is to also add public health to your repertoire. And then, you're positioned better really than other people in what should be a growing field. So I just wanted to belabor that, because I hope the students realize what there is here. It's tremendous opportunities.
Yeah, and thanks to all of you, that is true, Joe and Bar and Katie, the graduate students who pushed you all, right, who really were interested in this and allowed that work to go on with Julia and all the folks that we've heard from. I mean, it is really dramatic and wonderful to hear the paths that you all have had. So I'm thrilled, Joe, that you made that point, and I'm honored that we have all of you here with us, because I think, we have to figure out now, here we are and the world kind of caught up, and now, where do we go, right? I think that's really our next really exciting discussion to have, is the world is kind of caught up to where we didn't know if they were ever going to get, and now we have to push them, and in what ways should we be doing that? So I think it's really exciting. I don't know, Katie, if you wanted to comment or just.
Oh yeah, I was just going to echo Joe, and this is such a fantastic place, PAU, because pretty much every thing you hear about has some connection somewhere, right, to either PAU or Stanford or the VA. And so I think being first a student and now being able to, now I just basically sit in Bar and Joe's labs for inspiration, because it's Bar and Joe's meetings for inspiration. But there's so much connection here and so much amazing work being done. I know Dr. Munoz, I used to read his page when he was at UCSF, and I was going to apply for the internship, but then Dr. Munoz came over here. So I was like, hooray, like this is everyone that I've ever wanted to work with in one place. So Yeah, so it's been, for me personally, it's been a little bit like the, Oscar night. And I think it continues to be that way for tech mental health, and it will just continue to grow. So the opportunities are endless. So I encourage everyone to reach out.
Great. So we have a question from, I want to get to one more audience question, and then I want to ask my final question for you. But somebody's with us who is working as a product manager in tech, thinking about coming into the field of psychology, and realizes, I think rightly so, good for you, Hamza, that they need to get research experience. How can someone get research experience who isn't in graduate school yet, but who really is interested and wants to become involved? Do you have any thoughts about that? Have you seen pathways for that?
Yeah, I did that. So I started by volunteering, which, economically is really hard for a lot of people, right? It's hard to volunteer time when you're trying to make money to pay rent and stuff. And so I volunteered a few hours a week at UCLA, ironically on a study that looked at postpartum depression, but I was just setting up the tech. And that volunteer research role allowed me to get a paid research role at 401 Corey in the depression clinic first, and then in the sleep clinic with Rachel Manber. And so I think the research piece is really important. Many people will take on volunteer research as students if that's something people are able to do, even just for a few hours a week, which then can lead to the paid research, which then of course allows you to do coordination, or at least be able to speak about it in graduate school, and kind of decide what your interests are. So I think it's a great idea. Again, don't be shy. I have many people, undergrads, reach out to me and say, hey, how do I get started? Do you know anyone I can work for research wise? And I can point you to where the postings are, that kind of thing. But I do think that's an important step. And I think looking for a paid role or even a volunteer role can be a good place to start.
Yeah, no, it's funny. I worked for the federal government when I came out of college, but I wanted to stay, I wanted to do research. So I did exactly what you did. I went and volunteered in a lab in Georgetown, just to kind of, so I had that, I had something to talk about when I applied to graduate school. And someone else is asking about when we have a full-time military, somebody who's in full-time military service is also asking, this lack of research is, getting that research experience in order to get into graduate school is really important. And I think that, part of what we have to encourage people to do is to, have the conversations you've been talking about, just doing the networking, asking the questions, seeing what's out there.
And I just wanted to respond to that one, if that's okay.
Yeah, go for it.
Yeah, I see that you have clinical experience from working as an in-home care provider and also military service. And I just want to emphasize how important, certainly in my role at the VA, having military service and also clinical experience is to our role. And so, I don't know what specific graduate schools require, but I do know that having had the experience of serving and having clinical experience can be really essential when serving different populations. And so thinking about what kind of work you want to do in the future and how you can really emphasize that experience you've already had that's really unique and essential for a lot of the clients we serve can help with the grad school path quite a bit.
Yeah, and think about how much lived experience that brings to these questions. And one of the interesting challenges, and I think one of the things PAU does pretty well, is there are non-traditional paths,
yes.
and often those bring us the most interesting, experienced students, right? And I think it's really, it's certainly wonderful to have been a very, very strong academic student and have worked in a lab and kind of, do that traditional path. But from my own experience, I have found that where I have students who have had other experiences before they come to graduate school, it has made a huge difference in their careers and in my learning, what I've learned from them, so I think it's, don't ever underestimate the importance of all that experience, and the research piece is just, I was asking a student recently who said, I'm so worried I only have done clinical work, I haven't done research. And I said, oh, well, what have you learned from your client? She worked with children, and she told me something. And I said, well, what questions did that raise for you? And she said a question, and I said, well, then you're set up to do research on that question. That's really, that's what it takes. It's being able to ask really good questions, and then we'll equip you with the skills you need to answer those questions, or to address those questions.
Exactly. These global skills. My sister is actually, she's an attorney and is pursuing her MSW to do I really talked up perinatal psych. And, she has twins, and there's such a need for therapists who have the experience of having multiples, and also therapists who are attorneys, because we see a lot of attorneys. And, I think that, that kind of life experience is tremendous. And so when you're thinking about the work you want to do or getting the next role, really thinking about how that lived experience is important, and how you can frame it to show how it can be impactful.
Yeah, exactly. I mean, the ability to be able to ask really important questions, that's the basis of the whole enterprise,
Yeah.
So let me say, this series, thanks to Bar and all of the wonderful people who helped put this together, is called Superstar Psychologists in Technology. And one of the things we are trying to sort of do through these discussions is figure out how we at PAU can best support the research and clinical training experiences that our students need and that others need to ensure that we can produce the next superstar psychologists in technology. So what sort of final pieces of advice might you have for us and for our wonderful students?
Yes. Well, in line with what I said before about networking, I'm putting my email in the chat. And if anyone had a question that they couldn't answer, didn't answer, please email me and I will get back to you. But I think PAU has done an amazing job. I mean, I really do feel a tremendous amount of support, and all through school, I felt like I was able to get the skills that I needed to do this work. I didn't even know I had them. And so it's kind of the dream team, I think, for really psych and technology. As I mentioned before, I think, and you and I talked, Dr. O'Connor, about, how do we orient mental health students to the whole tech process? And I saw a question go by about working in teams and how do we kind of enhance team communication. That's something we talk a lot about, communication, right, in our training. And so how can we talk about working in interdisciplinary teams, not only in the healthcare settings, but actually now more and more right outside of the healthcare settings? How can we make the trainees coming out of PAU people who colleagues look to make those meetings go smoothly in the workplace? And so I think PAU just does an amazing job training in all these aspects. And so continuing to do what we're doing while adding the different elements where we see these roles taking on will be really helpful.
Yeah, I love that idea of sort of building out, right?
Yeah.
Starting with this wonderful core, but then thinking of these other areas where this space is really growing, and we should really be on the front lines there. So I think we're just about out of time. I am absolutely thrilled that you were able to join us, Katie, and we're just really proud of you and so proud of your career. I think, I love showing how paths can differ and they can excel in different ways. I think we sometimes get fixated on success looking a way. And I think we have demonstrated through this wonderful series, Bar, that success looks in many ways, and that's something that I think is important for our students and everyone to appreciate. So for that, we are very, very grateful to you.
I just want to thank you, Dr. O'Connor, for doing this. It's been such a pleasure for me. And thank you, Dr. Taylor, for the opportunity. And thank you, Cyrus, for setting it all up. It's really great. And again, any questions at all, send my way. You'll probably get more information than you want from me, but I love that. So thank you all.
All right.
Bye, everybody.
Good night. Thanks, everybody.